This conference will now be recorded.
Hello, everyone, and welcome to Paradigm Medical's training on mastering truncal compression garments. We're so excited to see so many of you here today. We know your time is valuable, and France and I have worked hard to create an informative session for you. Your dedication to learning and improving patient care is truly commendable. I'm Jennifer Wang, the president of Paradigm Medical. For those of you who may be new to us, we are a national distributor of specialized medical products with a focus on lymphedema, post-mastectomy, and orthopedic footwear and foot care. We're well known for our pneumatic compression pumps, as well as our lymphedema footwear, post-mastectomy products, and compression garments. For over 30 years, we've had the privilege of serving the Canadian healthcare community, and we're thrilled to continue this journey with you. For today, your presenters are myself and France Foster, who's a breast care fitter with well over 25 years of experience. She's just a wealth of information, so if you do have any questions, please do use the opportunity to reach out today. France, do you want to give everyone a quick hello?
Absolutely. Welcome, everyone. We can't wait to get this presentation presented to you so you can enjoy the benefits of it.
Yeah, we've had a lot of people register for this webinar, so I think the topic is very pressing and very good one. So just a couple little go-to webinar functions. Please mute your devices and turn off any cameras just to minimize any distractions for everyone during the presentation. And as well, if you have any questions, and we love questions, please use the opportunity to address them. You can use the chat function in GoToWebinar to ask. And France and I will be monitoring that, so we'll be sure to make sure that your questions are answered. So the goal for today's training is to enhance lymphedema patient care and to help your business grow through truncal compression specialization. Here's some of the agenda topics. We'll understand what truncal lymphedema is, what patients need to acquire one of these compression garments, how to build strong referral partnerships within your community, how to fit a truncal compression garment, how the construction, selection, dispensing, and care instructions, replacement and frequency of replacement, any insurance and tax incentives that are available, and concluding with any Q&A questions at the end. So to start, understanding truncal lymphedema. So right off the back, I just want to get out some terminology. There sometimes are confusion between what's the difference between a compression vest versus a compression bra, and sometimes even a mastectomy bra. So just to help clarify the differences, there may be some overlap, but a compression bra can be used for post-surgical or post-mastectomy uses, and it's primarily covering the breast area and to help support the breast. In terms of a compression vest, unlike a compression bra, a compression vest provides broader coverage, broader torso compression for truncal lymphedema, which includes the torso, the chest, the back, and it can be used for post-surgical and other chest conditions too as well. And it may or may not have a bra functionality. Just to note, some garments are a combination of compression bra, compression vest function, and this may lead to an interchangeable use of the terminology. So the terminology for these garments may also vary depending upon the insurance company or the health provider. So just be mindful of that. All the products we'll be discussing today are a combination of both bra and vest functions. So you get a wide range of functionality for these products. So the definition of truncal lymphedema, and this is a condition where there is swelling in the torso, chest, could be in the arm, shoulder, collarbone area, back, any scar lines from the surgery, and any subcutaneous fatty tissue. It's a common problem following breast cancer surgery, but it can also occur after treatment for lung cancer, melanoma, other upper body cancers. It could be a result of a significant infection or some kind of trauma to that area. It can be painful and affect the way a patient feels about their appearance. So some of the symptoms include discomfort and pain, particularly in the shoulder, chest wall, or back area. This may include as well swelling in the affected breast or chest wall, or it can be swelling all over in the collarbone area. It can be under the arm. It could be along the mastectomy scar lines, between scar lines from biopsies, drainage sites, or surgeries. There's a lot of lymph nodes in that area. So depending upon where the lymph nodes have been damaged, it can occur all along those areas. It can also cause swelling in the lateral trunk, in the shoulder blades, or in the back area. You may feel, patients may feel sensations of heaviness, fullness, or tingling. In some cases, the swelling can be very significant, and the swelling is a result of the lymph fluid not draining properly due to damage potentially of the lymphatic nodes in that area. And it can alter back stance because now there's an imbalance in your body and can cause lower back pain, even neck pain, things of that sort. In terms of prevalence, lymphedema appears to commonly affect people who've undergone types of radiation treatment for cancer. It's an estimate of 25 to upwards of 50% of people, and this could be men or women, who've undergone radiation or any type of surgical intervention for breast, lung cancer, and are added. All of these people are at an increased risk for developing truncal lymphedema. Just a couple of sources. There's one study referring to roughly about 13% of people who've had breast cancer and who've undergone treatment develop truncal lymphedema. Other estimates show it's upwards of 35%. This could present itself with or without swelling in the arm area. So typical treatment modalities, most effective being complete decongestive therapy. And this is a combination of a few modalities, which include compression garments, which are to be worn daily, wraps and bandages, manual lymph drainage, which is a massage technique to help move the lymphatic fluid, and as well pneumatic compression therapy. Similarly, this is a device which will pneumatically help massage the limb or the affected area or the truncal area to move the lymph fluid through the body. So what does a patient need to acquire a compression garment? So these are all, compression vest is a medical device. It's a class 2 medical device. It's regulated by Health Canada. So it does require a prescription. And as such, you do need a truncal lymphedema diagnosis from your doctor. The prescription may include things like the body type, the type of garment required, and perhaps the compression level, whether it be moderate, medium, high, and any additional clinical notes that require continuous use at need. Please note that you want to be in contact with the patient to ensure that as a fitter, you're up to date on, weight, the swelling, has it gotten worse? Has it gotten better? This will allow you to reevaluate the fit or any changes in their physiology to ensure that the garment is fitting their current medical condition, and that has been verified by a medical professional. So it's important as you incorporate truncal compression garments into your practice to build a strong referral network and partnerships. So things that will help you build that network is to, number one, to connect locally. So to establish relationships and build recognition with local therapists, doctors, hospitals, community groups that specialize in this area. You want to be their go-to truncal compression expert, and you want to position yourself as their trusted referral source. So it's important to make sure that you do that type of outreach. So you are establishing a consistent referral base. You want to also cultivate reciprocal referrals. If there are any patients that you see, you can always refer them to these other community, whether it be therapists, doctors, hospitals, or groups. And you want to make them your primary source for lymphedema patients. And to help with that, we have produced a truncal lymphedema brochure. This is available to all of our retailers, and we are able to customize it with your business information. So this is just a sample, the front and back of it. Where you see all that Paradigm Medical information, we can remove that and replace it with your business contact information. So your logo, your address, your phone number. So this is a really handy and great tool to leave at your referral sources and to provide patients and your clients to ensure that they're aware that you're trained and you are an expert in fitting these products. If you're interested to learn more or you'd like to place an order, you can reach out to Mina at info@paradigmmed.com. We'll have all the contact information at the end of the presentation. She's also the one who sent out the dial-in information, so you have that available on hand. And now I will pass it over to France to discuss the fitting.
Thank you, Jennifer. All right, so let's talk about this fitting part. Some of you may or may not be experienced fitters, and that's okay. We do highly recommend that you have one of the following prerequisites in order to be able to fit your clients properly. So being could be an experienced mastectomy fitter or an experienced compression garment fitter, or having some basic understanding of lymphedema. So it all varies depending on which area of the which area you specialize in. And if you don't know some information, well, hopefully we can fill in some of those gaps for you. So we're going to start just to talk about the anatomy. Exactly what is the trunk? So it's essentially the body part that excludes the head and appendages. And what it does include is the shoulders, the clavicle or collarbone area, the chest area, the breast, the abdomen or belly, the axilla area, and the back. So it's also divided between the upper trunk and the mid trunk. So that's the basic anatomy for what is exactly the trunk. In the next slide, we see the lymphatic vessels that that are associated with the trunk. And as you can see, there are a lot of lymph nodes. There's numerous lymphatic vessels and nodes that are located throughout the truncal area. Therefore, when truncal lymphedema occurs, you can see why it's important to treat it, simply due to the sheer number of vessels and nodes that are located within the area. Now, if you have mastectomy fitting experience, it will be easy for you to apply that knowledge to fit compression garments. And the method is actually very, very similar to fitting a mastectomy bra. So that'll be an easy step. But because not everyone in this group may necessarily know exactly how to do that, we are going to cover that as part of the different ABC truncal compression garments that we will be talking about. And this is included in that brochure that Jennifer mentioned. So it details all of the information that you need in terms of the compression level, the sizes, the colors, and all the information that you need to make your selection. Now let's talk about how to measure for the vest. So again, that's a very similar process to fitting a mastectomy bra. When you take the measurements, they are to be taken with a garment on. So it's either an existing bra that she's wearing. And so and sometimes a patient may present without wearing a bra or a vest. So you have to start out with asking her what size bra or vest she typically wears and use that as a starting point. And then just go through the other steps of measuring. You want to make a notation, however, in your intake form that the patient presented without wearing a vest or garment. You always want to use a measuring tape when you're doing this fitting, because first of all, you do need to do it. It also lends credibility. It builds patient confidence towards you, and it gives the impression of a custom fit. So you want to record those measurements in the intake form. Now there are 3 simple steps. The first measurement that you require is the band measurement. So in order to measure for the band, you measure the patient's circumference where the bottom band of the vest would naturally sit on her body. And this measurement should be snug and also parallel to the floor. Whenever you take any of these measurements, they should be parallel to the floor. And that is because if there's a slight deviation or a slight angle of the measurement, it's going to affect the actual result. So you need to make sure that it's parallel. While you're taking that measurement, you want to have the patient hold her arms at her sides or on her hips while you take that measurement. And then you would add 4 or 5 inches to achieve an even number, because vests or bras are only available in even band sizes. We have a quick fitting tip here. So you may have someone who comes in in a wheelchair, and so they may be in a wheelchair, but it doesn't mean that they can't stand. So they may not be able to ambulate, but they can stand. So it's okay to ask the patient if she's able to stand. If they cannot, then you measure her while seated. And when someone is seated and you're taking that measurement, you do not add extra inches to the band size measurement, because the chest expands naturally in the sitting position. So it's important not to add those extra inches to it. The second step is to take the cup measurement. So you're going to measure from the center of the patient's sternum, which is the bony section between the 2 breasts, over the apex, which is the most projected area of the natural breast, under her arm and to the center of the spine. Again, This needs to be a parallel to the floor type measurement. It should be taut, but you don't want to compress her natural breast tissue when you're taking this measurement. Once you've obtained that measurement, you want to double this number. We'll give you some examples, don't worry. And step 3, now you want to calculate the difference between the cup measurement and the band measurement. So the difference between the two is going to help you determine the patient's likely cup size. So when you have a difference of 0 inches, it's a double A. 1 inch is A, 2 inches is B, etc., and so forth. So let's do a quick little example of how this works. So the band measurement let's say we have a band measurement of 30 inches and have a cup measurement of 18 inches. So your band measurement being 30, you're going to add 4 inches to make that an even number. The cup measurement is 18 times 2, so you end up with 36 inches. And then you take the difference between the cup measurement and the band measurement to obtain, in this case, a 2-inch difference. So that means that that person is likely going to be fitted into a B cup. We've already determined that the band measurement is 34. So 34B. Now, if the band measurement is 38 inches or more, you only add 1 or 2 inches instead of 4 to 5. So example, if the band measurement is 44, you only add 2 inches, and the patient may wear a 46-inch band, or she may wear a 44. Fitting is really not a science. It's really an art. So with time, with doing more fittings, you gain a lot of knowledge and a lot of experience, and you're able to do these very quickly and efficiently, and you'll get the hang of it. So when determining the vest size, there are different the different models. Some models require the band and cup measurement, and we'll go through those as well. So the 519 and the 619 bras require an actual band and cup measurement to determine the size, whereas the models 119 and 520 only require a band size. So as an example, the 30 under 38 inches in the 119 bra, as well as the 520 bra, it amounts to a large. So that's called alpha sizing for small, medium, large, etc. Okay, now if you encounter someone who has a flat surgery, or if it's a man, this patient would most likely benefit best from a 519F, which is the 519F flat bra, for which you only need the band size to make your selection. You want to measure for the band size if the client is looking for a flat garment. So in addition to bilateral and flat closure surgeries, this garment is also good for women who are looking for a higher level of truncal compression. So someone who has a remaining breast is also able to wear the 519F. The only difference is that one has a molded cup and one doesn't. So Jennifer's going to play this video that explains a little bit the process of doing the measurement. It's a little bit more visually, you can understand a little bit more because it's visual.
Hello. This video is a quick review on how to do a fitting on a mastectomy patient who has come in to get a breast prosthesis. So the first thing that we need to ensure is that the patient comes in with with a bra on. If she, for some reason, does not present with a bra on, you would need to ask her which bra size she used to wear, and kind of go by that, but not necessarily rely completely on that, because sometimes patients were not wearing the correct bra size. So when we're doing the actual measurement, we want a tape measure that has inches on it, and the first measurement we're going to take is the band size. So we're going to take the tape measure and go all the way around, and we want this to be parallel to the floor and also nice and snug on the body. Okay, so we want to pull tight and take that measurement. In this case, I get 28 inches. So to that, I'm going to add 4 or 5 inches, whichever number gets me to the even number. So in this case, it's going to be 4. 28 plus 4 is 32. So this person is wearing a 32-inch band. The next measurement we're going to take is the cup size measurement, which we take by going from the center of the sternum to, center of the spine to center of the sternum, without applying any type of pressure on the breast tissue. Okay, so this is just done just over top. In this case, I get 17 inches. So the 17 inches is multiplied by 2, giving me 34 inches. So we have 34 inches for the cup size and 32 inches for the band size. We take the difference between the two, and in this case we have 2 inches, meaning that this person wears a B cup. So she's going to be a 32B. Very simple. So another fitting tip that you should know about is that if the band measurement is over 38 inches, or 38 inches or more, you would only add 1 or 2 inches to that measurement instead of 4 to 5 inches. So for an example, if the band measurement is 44 inches, you add 2 inches, which would make the band size 46. But just as well, the patient could be wearing a 46-inch band, just as she could be wearing a 44-inch band. So it's really a matter of trial and error, and that this type of fitting is not an exact science. When a patient is a bilateral patient, you would take the band measurement only. You would ask the patient what cup size she would like to wear going forward. She may choose to be bigger or smaller, but her new cup size should be proportionate to her body. So it's best to recommend a size that is within 1 cup size of her pre-surgery cup size, so maybe 1 up or 1 down. And that's how you do a fitting. Thank you.
So again, just to reiterate that this was an example of a mastectomy fitting, but again, it applies totally to doing the same process to ensure that you get the correct measurement for a compression vest. Now, there are factors to consider when you are doing that fitting. So if you look at that model at the top being squeezed, you really want to avoid that tourniquet effect. Okay, you don't want to fit a vest that squeezes or traps fluid in places, which prevents draining. So it's counterproductive. You also don't want to size down for any reason, which would obviously cause a tourniquet effect. You want to ensure that wherever the woman is experiencing swelling, that the fabric of the garment is supporting and smoothing in addition to applying compression. So consider also the straps and the bands of the garment. She may prefer a different type of strap closure or even front closure. And you also want to ask yourself, will the lymph that is getting encouraged to move out of that area have somewhere to go? So again, you want to consider all of those points. Again, on the tourniquet effect, ensure that the entire swollen area gets covered by the garment. You want to fit the patient snugly with no baggy or loose areas, which will only cause pooling in that area, so you don't want that at all. The garment should also let the patient move freely without causing any pain, discomfort, numbness, or tingling. Second step is to, not a step, but as far as factors to consider, fit her to the size that she presents at the time of appointment. So you measure her and you find the right vest size for her at that time. Maybe at the end of the day, she might be a different size, depending on which time of day that you've taken the measurement. But you need to fit her and find the right vest size for her at that time. Compression garments have built-in compression. So as soon as you apply them, they're going to start doing their work. You don't want to fit the woman in a vest that is too small or too big, because again, that's going to be counterproductive, and also depending on what level of compression she needs. You must refer to the sizing chart to make the correct selection as far as a product, and refer to the garment compression level for the amount of compression that is to be provided to the patient. Again, we have the chart here to show you the different compression levels. Again, the 519 offers the highest compression level because it's a flat, non-molded cup. It has a front zipper closure and Velcro padded straps. The 519 without the F is a compression vest that has molded cups, so that's the only difference between those two. And the 619 Restore vest is a similar design to the 519, except that it has a different swan and hook and loop shoulder strap. And the other two, the 520 and the 119, are moderate to low to moderate type of compression garments, and those have the alpha sizing. So you base your selection based on the alpha sizing. You also need to consider any changes in medical conditions that may occur. So ensure that she has proper documentation to indicate any changes in her medical condition. And what that means is that if there's any change in medical condition that are weight related or severity of lymphedema, it can make the patient eligible for new garments that you may have already dispensed. It doesn't matter exactly when, but you can apply to the insurance, or the patient can apply to the insurance in order to get new garments if her medical condition has changed. And finally, compliance. Compliance is obviously very important. It's not going to be effective if she doesn't wear it. So the garments are only as good as the compliance of the wearer. So you have to ensure that she likes it, that she can put it on and off herself. It has to be relatively comfortable, and you want to avoid the fact that she's not going to wear it because of a number of factors. So it won't be productive for her care and maintenance if she doesn't wear it. For daytime garments, consider giving her one garment that is the best product for her maintenance, even if she'll only wear it sometimes, and give her another product that you know she will wear all the time. So having a couple of different options helps to ensure compliance.
Thank you, Franz. So we'll pass it back to me, and I'll review the garment construction. These are the 5 truncal compression garments that are available. I'll review. We've got them organized from high levels of compression to low to moderate. Just to add another factor to consider based on selection could be the fabric that the garments are made out of. Most of these garments, all of them except the 520, are made with cotton. The 520 is a nylon, primarily a nylon based construction. So patients may have a preference. A lot of patients like natural fibers and natural fabrics. So depending on their personal preference, that's something to consider. In terms of garment selection, there is a difference between daytime garments and nighttime garments. Daytime garments typically have a stronger compression. They can be worn in more active scenarios and usually have a high to medium kind of compression level. And that would include the 519 flat, the 519 with the molded cups, or the 619. For nighttime garments, generally there is a mild compression level compared to daytime garments. And these can be worn when lounging or sleeping. And they typically have a moderate to low compression level. These equate to the 520 or the 119 garments that we're discussing today.
Jennifer, I'm sorry to interrupt, but I think
No
you
problem.
skipped a few slides. So if you can go back to garment construction, there should be actually like 6 or 7 slides there. I think you forwarded too quickly. Yeah, keep going up.
This is going down now.
Yeah, you're missing a whole section about the construction.
It might be further down, so let's just, I may have moved them around, so we'll,
okay.
yeah,
Okay.
we'll just keep going. So here's the selection. Where did we stop? Okay, nighttime versus daytime garments. So it's important to note that compression levels are not always equal from one woman to another. So one woman might need, what one woman might need for her nighttime garment might be the same level of compression a different woman needs for her daytime garment. So it's very dependent upon the individual patient's needs. So that's why it's important to ensure that they're being properly fitted, and as well we're assessing their comfort level in addition to what their doctors are prescribing them. So in terms of the selection, here's just a comparison of high to medium compression level garments. So the high would be the 519 in the flat without the molded cups. And then you also have to the right a 519 compression breast, which overall provides a lower level of compression, a medium level of compression. This one includes molded cups. So it could be used for the same woman, just different levels of compression. The 619, very similar to the 519, has the main difference, similar construction made out of cotton, front closure. The main change is the swan and hook loop shoulder straps. Some people prefer that to the Velcro. Just to reiterate, the sizing would be the same as if you were to measure for a mastectomy bra, and this requires both a band and a cup size measurement. So all three of these products are made with cotton primarily and spandex, and have a zip front closure. They have good coverage on the back, under the arm, and the 619 is updated with the swan hook and loop shoulder straps. They lie a little bit flatter under your clothing, so people like that and prefer that in those instances. So two options for clients who are looking for more of a moderate to low level of compression. You've got the 520, the active recovery compression vest. Both of these, the 520 and the 119, use alpha sizing. So here you only measure for the band. You don't need to measure for the cup. And then you would refer to that alpha sizing chart that we saw earlier to determine what size the client is. The 520 is made with nylon and spandex. And then the 119 is cotton and spandex, primarily cotton. The 520 has the hook and eye closure with the front zipper. And the 119, similar, but it uses Velcro for both the adjustable straps and the front closure. So Truncal Compression Garment Dispensing. Franz, I will pass it back to you.
Thank you, Jennifer. All right. So truncal lymphedema compression, your dispensing obligation consists of a few things. So reviewing contraindications to help prevent adverse effects, and the contraindications will be on the next slide. Taking measurements of the patient's affected body area, performing necessary fitting services, training the patient on how to take the treatment item on and off, showing the patient how to take care of the treatment item, which we'll also cover, and doing any adjustment of the treatment item if needed, and any follow-ups, because we want to ensure that your client, that her medical condition doesn't change, and if there are changes, that she is able to get the right compression garments that she requires. The contraindications for truncal lymphedema include severe arterial insufficiency, uncontrolled congestive heart failure, acute infection or cellulitis in the area, untreated deep vein thrombosis, sensory neuropathy, which is a diabetes-related condition usually, skin conditions such as open wounds, fragile skin, radiation burns, uncontrolled hypertension, recent surgery with healing incision, and severe lymphedema with fibrosis. Now, in terms of garment care, we'll go through a few points about that. So the proper use and care of compression garments are absolutely crucial in order to maintain color, shape, elasticity, and what you really need is the optimal therapeutic benefits. So rotating garments is very important. It extends the lifetime use of each garment. Having multiple garments to cycle through will give the garments time to return to their original shape between wears, meaning that while one is getting washed or dried, you have another one available for use. So it's really important to have more than one garment. Washing it regularly, which helps maintain its elasticity. Daily washing of the compression garments help remove any body oils, lotions, deodorants, etc. that may come from the body and that may break down the compressive properties of the garment. It's preferable to hand wash or machine wash on delicate cycle only with a garment bag in cold water and air dry it. Never put it in the dryer. So avoid using the dryer. Avoid using bleach or fabric softeners as well. And when the time comes that the garment does not return to its normal shape, it doesn't feel compressive, it may have holes, and is just too easy to put on, it's actually time to replace the garment. And back to Jennifer about replacement and frequency.
Thank you, Franz. So knowing when to replace a compression garment is really crucial to ensure that there is effective treatment and maintenance. In general, it's recommended that compression garments are replaced every 3 to 6 months. So this is important for the retailer to follow up at these touch points with the patient to book appointments so they can come in and get fitted to see if there's been any changes to not only their medical condition, but potentially the garments are due for replacement. If you do notice at these times the garment does not provide adequate compression or showing signs of wear, it is essential to advise the patient and the client that it's important to get them replaced. Otherwise, it's not providing the proper treatment and maintenance for their truncal lymphedema. So here's an example visually of what we're referring to when we're saying ill-fitting garments or garments that have lost their elasticity. As such, they will lose their effective compression. And they won't be as beneficial to managing the lymphedema. This can also be triggered by any kind of weight loss or gain. And if that does occur, the patient should advise the fitter or therapist that it's time to replace the garment. And if the garment doesn't fit properly, there will not be appropriate pressure applied to the affected area, which is critical for lymphedema management. So wear and tear, this is common. People run it through the washing machine on, an aggressive cycle, which can damage the garment. If they put, a pair of jeans with spikes on it, you can damage the garment. So it's very important to treat these delicately. Best to hand wash or put them on delicate cycle with a garment bag to protect them in cold water. The fabrics, if they're worn frequently, can thin over time. There can also be small tears or frayed edges. These all decrease the integrity of the compression garment, which means the client is not getting the level of compression that's required. If you exceed the recommended usage window, that can also cause wear and tear and compression garments that are no longer effective, and fabric breakdown. This may or may not be visible, but it happens over time. Next off, we'll just touch a high level on insurance and tax incentives. So once again, I'll mention that these truncal lymphedema garments, these compression vests, are Class 2 medical devices deemed by Health Canada. So in order to purchase one, a client does need a truncal lymphedema diagnosis if they're purchasing it for that purpose and are looking to get insurance coverage. A prescription is required for reimbursement or to use it as an income tax deduction on your tax return. So there are several funding and coverage options that are available. Given that we're going to be talking about across Canada, we have an audience across Canada. I'll just briefly touch on there may be provincial healthcare coverage through provincial health plans. I know that ADP does have coverage for a lymphedema vest. We're currently in the process of listing our products with ADP. So hopefully once that goes through, then that will be available. I believe RAMQ in Quebec also does provide coverage for lymphedema vests. But it's important to contact your provincial health ministries for more information on the specifics in terms of what type of prescription, what type of diagnosis, what type of information you need to, or the client's circumstance needs to be in order to get coverage. There may also be coverage through private insurance. Many private insurance plans do cover compression garments for conditions such as lymphedema. These products are also, if the client has a prescription, are eligible for income tax deduction. They are an eligible medical expense and can be deducted on your tax return to help reduce your taxable income. They are also zero-rated medical supplies. So if you do provide the retailer with a prescription, there is no GST or HST that is applicable. Overall, it's best to advise clients and patients to review their benefit plans to further understand what type of coverage is available for these truncal compression garments, because it does vary dramatically across the country. In terms of just the process of clients paying and getting reimbursements. So in terms of from a retailer's perspective, the client would pay in full, and then the client would seek reimbursement from their provincial or private insurance provider, or pay out of pocket. Sometimes there's a balance that that remains, and the client will pay that balance out of pocket, and or claim it as an income tax expense on their tax returns.
Hi, Jennifer. We have a question from Debbie, and
Hi, Debbie.
She would like to know if, I assume you would, will you let Ontario vendors know if you get the products added to ADP?
Yes, we will. We're just in the process of right now, and once that we get the formal approval that the products have been listed, we will absolutely advise everyone. Great question. So in terms of expanding your skills, as Franz had mentioned, it's always helpful to have further training. Here are some additional training programs that Paradigm Medical offers. So for those of you who have not done the mastectomy fitter training, that's always a really great one to complement today's training on truncal compression garments. I'll give you a more in-depth understanding of mastectomy fitting and breast cancer related issues and concerns to be mindful of. We also offer a pneumatic compression pump fitter training for those of you who see a lot of lymphedema patients and those who are looking for whether it be in the clinic or at home treatment. That is a great one for those types of situations. And then as well, we also offer orthopedic footwear and foot care fitter training. Many of you may also see clients with lymphedema in the lower extremity and require specialty shoes, so lymphedema footwear, to help with the extreme amounts of swelling and volume. We also offer a training program so that you become a fitter for those products too as well. So if you are interested in any of these three training programs, please let us know, and we will be sure to register you. So here is our contact information. That's the team there on a nice sunny day in Toronto, enjoying the patio. Mina, as I mentioned earlier, info@paradigmmed.com. She probably reached out to you with all the dial-in information. If you do have any questions, you'd like to sign up for some additional training, or you would like access to that customized truncal lymphedema brochure for the compression vest, please reach out to Mina, or Sandra too as well, whoever you're in contact with, or give us a call, and we would be happy to assist you with that. With that, I will open it up to Q&A.
Debbie is asking if we're able to share the video recording in PowerPoint.
We're recording the video today. So after today's presentation, we will send out a link. We'll probably post it somewhere, and then we'll make it available to everyone who attended today. So if you want to review it, that will be available to you.
Perfect.
Yeah, Allison had the same question. So yes, we're recording the video, and Mina will likely send it around later this week or early next week once we get it all processed, and make sure that you guys have access to it. So Cherie had a question about, can any of these products he spoke be listed as a compression vest because some insurance company don't want to pay for a bra? Yeah, so if the patient does have lymphedema, it has been diagnosed with lymphedema, then these, and because once I mentioned earlier the definition between compression vest versus compression bra, these are compression vests. They meet the definition of a compression bra, vest, excuse me. They also have a bra functionality to it, but they are a compression vest for the treatment of lymphedema. So it depends on the insurance company. Some insurance companies don't provide coverage for compression vests, or they may only provide coverage for mastectomy bras. So depending on the patient's diagnosis and situation, you'd have to make, you'd have to what's the terminology I'm missing? You'll have to define the product accordingly. I'm not sure if I was clear about that, but please let me know, Cherie, if I wasn't. We'll give everyone a few more minutes in terms of questions. Alrighty, France, what do you think? We'll give everyone one more minute, and
Yeah, sure.
we'll wrap it up after that.
Mm-hmm.
All right. Well, thank you so much, everyone, for your attention and your time today. We're really appreciative, and we hope that the session was informative. If you do have any questions afterwards, please don't hesitate to reach out to us. We're always available. And we look forward to seeing you at the next one. So have a wonderful day, everyone, and we'll see you guys soon. Take care. Bye-bye.
Bye for now.